I'm Eric Ruska,
I'm Courtney, and I'm Libby Shannon.
and today we're going to discuss about the different influences drugs have in society and the different components that makes it a really big problem. And to kind of explain our diagram, I'm going to cover the impact of drugs and where they come from, the trafficking, heroin epidemic, and then Courtney's going to explain schools, the gang violence, the type of medicine in schools, the type of drugs, and then into nicotine, which Libby will cover through caffeine, sugar, health disparities, and ending on addiction. So the impact of drugs that have on society are pretty negative. They leave long-lasting effects, and they leave people homeless, jobless, and they more importantly affect families and younger children. And drugs nowadays come in many shapes and forms, and more importantly, there are legal drugs such as prescriptions, alcohol, and tobacco. And according to the National Center on Addiction and Substance Abuse, in 2005, 35.6 million children lived in a home where an adult or guardian used a type of drug such as tobacco, alcohol, or an illicit drug. And of those 35 million, 9.2 million lived in a home where it was just strictly illicit drugs, such as scheduled drugs like marijuana, cocaine, heroin, or methamphetamines. Using drugs leaves a bad influence on children because it leaves a negative effect on their mind. It can also lead to learned behavior, such as influencing them to pick up a bad drug habit as they get older because they're using these drugs to escape the reality that their parents or whomever in their home is using them. And according to the National Center on Addiction and Substance Abuse, drugs have a bigger impact on lower income areas and places with higher unemployment because people use it to escape the reality and get away from their problems. And the drugs get into the different society and communities through drug trafficking. And drug trafficking is considered the growing, the manufacturing, selling, and distribution, all the way till it gets into the hands of an abuser or user. And according to the United Nations Office of Drug and Crime, in 2008, there were main areas that drugs were created and manufactured. And specifically overseas, Afghanistan and Myanmar, which is also known as the Golden Triangle, are the two main producers of opiates, which include like heroin. And also, Colombia is a main exporter of coca leaves, which then turn into cocaine and other stimulants. And once they make their way out of those countries, they find individual distributors through cartels and individuals who then transport it along the way. And as heroin is one of the largest distributed drugs worldwide, in a study by the United Nations in 2008, 73.7 metric tons of heroin was seized around the Afghanistan and Myanmar area, leaving the countries to be sold illegally and make profit off of. And with technology growing more rapid every day, it is giving drug dealers an easier way to smuggle these drugs into countries. And in the United States currently, and more importantly Ohio, one of the biggest epidemics they're facing right now is a large heroin epidemic. It is causing more people to be hospitalized and even facing death because they overdose. And according to a report done by CNN in September 2016, Ohio alone reached 110 deaths up to that point in that year. And technology is also making it easier for people to OD because different distributors and dealers and manufacturers are chasing components of drugs, and people are finding new ways to use and take drugs. And people are learning how to use these different types of drugs at younger ages because they're learning through different gateway drugs which they get from their school.
Okay, which leads into mine about how drugs are related to into schools. So if you look back into high school, I bet all of you can think of at least one person in your school who you knew used drugs, or where you knew you could buy them from. as he talked about the heroin is becoming such a big deal in schools now because the students were using, Adderall, more prescription drugs, things like that, but they tend to wear off and you become immune to them. You can't get the high anymore, which is then heroin is actually cheaper than prescription drugs. So teens are now going to heroin, which is worse than prescription drugs, but it's also laced with different things, and as a teenager we don't think about it. So that is, the heroin epidemic is now spreading into our schools, as he said. Our drugs that are in schools, that there was a quote saying that schools are becoming more of a business than a learning place because of all of the things that are being sold within the schools. Students are starting to smuggle drugs into schools in makeup containers, water bottles. They bake it into goods, brownies, cookies, cake, whatever, you can do it, and electrical equipment. So they're starting to place like baggies of it and the battery parts of unused phones. So they're getting very tricky with it. According to Richard Lowry, the Journal of School Health in 1999, interpersonal violence and substance abuse and major contributions to premature death, disability, and social problems among youth in the United States is related to drugs in schools. 90% of students say they know where to get drugs in their school. So, like I said, prescription drugs, marijuana, that's just a gateway drug until they reach a higher level. Which then we go into like ADHD. There are students who are taking the medication from students who do have ADHD and they are abusing them. Young adults and college students often use Adderall without a prescription to stay awake. So during exam time or big tests, students are taking it. And it does have an effect on people who do not have ADHD. It actually messes with your brain because it's a stimulant. So it affects your GPA, your brain cells. 11% of children from the ages of 4 to 17 have been diagnosed with ADHD, which is an increase of the diagnosis has made Adderall more available to students. And Adderall abuse, you don't feel like you can abuse Adderall, but you can because it is a Schedule II controlled substance, which means it is meaning high potential for abuse. Which then we go into gang violence in schools. Like he said about how the heroin epidemic and drug trafficking. Students are getting involved in drug trafficking, which is then relating to the violence in schools. According to Jeffrey Fagan from the Criminology Journal in 1989, gang members always have been involved in collective and individual violence, and in recent years in drug use and drug dealing. There was a story about a 15-year-old named Caesar who was involved in drug trafficking, and he thought that he was going to start a new life for himself and get out of drug trafficking and everything, until he got a text one day from the leader of the gang that he was in, saying that if he didn't sell or do the job that he wanted him to do, then he was going to kill him and his family. So you never really get out of the whole drug trafficking or the whole gang thing, but it's bringing it into schools who are now making it more drugs more available to students. 42% of youth gangs in the U.S. were estimated to be involved in the street sales of drugs. Which then we go into the types of drugs. There are a bunch of different drugs that students are using. Marijuana is going to be your #1 drug besides alcohol. Prescription drugs, cocaine, and students are taking ecstasy. The prescription drugs that are being sold in schools are Adderall. They are abusing cough medicine and Ritalin. There's also something to K2, which is also called Spice, which is a herbal mixture of drugs. The signs of drug use are bad grades, bloodshot eyes, you avoid eye contact, poor hygiene, unusual tiredness. And the reason that students are starting to do drugs more is because they're curious. It's technology. They see it online, like this looks cool, it does this for you. Peer pressure, stress, emotional struggles, and a desire to escape their reality. So now we're going to go into Libby.
Okay, so kind of going off that, I'm going to talk about some of the types of drugs that are more commonly used and misused in North America. The first one I'm going to talk about being nicotine, because as our generation knows, oh my goodness, do I stop? Do I keep going? Okay, sorry. So as our generation knows, nicotine and tobacco use is bad. We were educated, there were Surgeon General warnings. However, 85% of smokers who try to quit today end up relapsing in about a week because they've already started. According to the Advanced Addiction Science Department of the National Institute of Drug Abuse, nicotine has a vast number of effects on the brain that what makes it so addictive. It activates the reward pathways in the brain, which help regulate the pleasure sensors throughout your mind and throughout your body. Dopamine, which is the main neurotransmitter associated with drug use, it rises when someone smokes, and it releases a calming and relaxing feeling throughout the body. And now cigarettes produce a rapid distribution of dopamine throughout the brain from when the nicotine is being breathed in, and that can activate within 10 seconds of inhalation. So it's almost an immediate body high, while as the nicotine wears off quickly, and as do those good feelings and pleasures, causing a smoker to continue using tobacco, and it makes it hard for them to quit because they want to keep up those pleasurable effects and they want to prevent withdrawal. Withdrawal symptoms include, but are not limited to, irritability, cravings, depressions, anxiety, attention deficit, and weight gain, whereas withdrawal can begin within just a few hours of having a last cigarette. These reasons cause nicotine to be the second most addictive substance, with heroin being the first, and it is a Schedule II substance on the controlled substance schedule. Going off that, caffeine is also something most people don't consider it a drug. However, it is a very highly misused and abused substance, especially in the United States. According to the Johns Hopkins Behavioral Pharmacology Research Unit, it is the most commonly mood-altering substance taken in the entire world. Caffeine is found in a number of plants, but is most commonly consumed in coffee, tea, energy drinks, and sodas. It's estimated that 85% of adults that drink caffeine daily in the United States, they experience unpleasant side effects when it wears off, and if they go without having their morning cup of coffee. This study on caffeine dependence shows that as little as 30 milligrams of caffeine per day can alter the mood and affect behavior, while as much as 100 milligrams per day can lead to physical dependence and withdrawal symptoms. The amount of caffeine that has been put in soda pop over the last 20 years has increased drastically through demands. And just to give you guys some reference, one can of Coca-Cola has about 29 milligrams of caffeine in it, and a cup of coffee can have anywhere between 50 milligrams to 80 milligrams, depending on how dark, bold, or strong it is listed as. The darker the coffee, normally the more caffeine it has in it. Has similar side effects as nicotine, as I previously mentioned, with the irritability and all of the cravings that come with it, especially headaches and muscle fatigue. So again, another commonly misused substance in America is sugar, whereas when sugar is ingested, it releases opioids and dopamine into the brain, creating, again, potential for addiction with those pleasure pathways being ignited. However, according to the Study of Evidence for Sugar Addiction by the CDC, there are behavioral and neurological chemical effects between intermittent and excessive sugar intake. So when you take just a little bit of sugar, say you're a very healthy person and you have maybe just a few cookies at the end of the night, you're going to experience a sugar high. It's going to kick in really quickly and you're going to feel that buzz. However, if you use excessive amounts of sugar, you're not going to necessarily feel that, and it's going to have more drastic impacts on your physique and your physical body, as we can see, as some of our classmates have talked about with obesity. Something that makes sugar so easy to misuse and abuse in our country is that it's everywhere, and especially confection sugar, which is synthetic, and it causes a lot of weight gain, but it is so delicious, some people just can't get away from the sugar buzz. So, as I've talked about, all of these substances are very highly addictive, and addiction comes with the chemical components of the brain, whereas when they're out of balance from the use of unnatural and naturally occurring substances, it's very easy to get the chemicals in your brain imbalanced, because when you have an increase of dopamine and any other serotonin uptakes, your brain stops naturally producing those, and then once it wears off, your brain isn't naturally producing the dopamine, so you have less than what you started with, causing a lot of different adverse side effects. And this is basically where the imbalance of addiction comes in, and this information comes from the Oxford Medical Journals. And the main issue that exists with this is when the brain takes inventory of the chemicals being produced, it stops producing the ones that you need, and it starts trying to combat the ones you get. So it really just messes everything up in your brain and causes so much chemical imbalance. Side effects often include, like we've talked about, the terrible mood, irritability, and trouble with decision making and reasonability. Because when someone is an addict and they're craving, they're not thinking with such a clear head. They're clouded. Their chemicals in their brain are offset. Their temptations are at their highest. And this causes a large proponent of depression in drug addicts and makes them want to keep using in order to feel better because they feel bad. And it makes them want to use even to feel normal again. And this aids the real cycle of addiction, and it causes the person to continually use and misuse illicit substances. So the more they get used to it, the more they need it, and then they'll need it more to feel the same effects or to even feel normal by any basis. So all we've talked about today comes down to the health disparities that drugs really produce into our society. As you can see through our influence diagram, nicotine, caffeine, sugar, heroin, it all relates to addictive substances, whereas all the forms of addiction influences the health disparities that are experienced in our society. I'm sure each one of us in here knows someone who is an addict, whether it's addicted to caffeine or addicted to heroin. Addiction causes our friends and family members and our loved ones to make decisions that negatively affect themselves and the people around them. Whether it's something as serious as stealing money and possessions to sell them to get money for drugs to satisfy their urge, or if it's something as small as getting snappy with your roommate because you haven't had your morning cup of coffee. Addiction really decreases the quality of life experienced, and in many different ways it attributes to not only the heartache that families feel from their loved ones being addicts, but it also associated with climbing healthcare costs and filling hospital emergency departments with overdose victims, putting a strain on our resources, spreading HIV and AIDS through the use of dirty needles from addicts, and decreasing overall physical and mental well-being, and the substance abuse it causes. And this is why it's one of, I think, the largest wicked problems that exists in our society right now, because it reaches so many different components and aspects of anyone, despite their age, despite their gender, despite their ethnicity, and it really affects and touches everyone.